Hello, everyone, and welcome to our virtual presentation of Dr. Leana Wen's memoir, Lifelines, A Doctor's Journey in the Fight for Public Health. Joining Dr. Wen today is historical fiction author Lisa See. We have signed book plates available for those who purchase a copy of tonight's featured book. Just click on the green purchase button directly below the viewer's screen, and it'll take you to our website where you can complete your purchase. Just make sure to write signed book plate in the order comments when you're checking out your cart so we can reserve a signed book plate for you. Also, we will be doing an audience Q&A towards the end of the event. To submit a question, just use the Ask a Question button at the very bottom of the screen. You can also vote for any questions you'd like, and the more popular questions will come up to the top of the list. Also, please make sure to phrase all comments and questions with respect. We want this stream to be a safe place for discussion for everyone. Anyone who is disruptive or making inappropriate and hurtful comments during the stream will be kicked out of the stream. All right, so with that out of the way, let me introduce our guest and then we can jump right into the conversation. So Dr. Leana Wen is an emergency physician, public health professor at George Washington University, and a non-resident senior fellow at the Brookings Institution. She's also a contributing columnist for the Washington Post and a CNN medical analyst, who you may have seen a couple minutes ago on CNN. Previously, she served as Baltimore's health commissioner, where she led the nation's oldest continuously operating public health department. And joining her tonight is Lisa See, the New York Times bestselling author of The Island of Sea Women, as well as many other critically acclaimed novels. She's also the author of On Gold Mountain, which tells the story of her Chinese-American family settlement in Los Angeles. She was the recipient of the Golden Spike Award from the Chinese Historical Association of Southern California and the History Makers Award from the Chinese American Museum. So with that said, I'm going to turn my camera off and hand things over to Lisa. Enjoy the talk, everyone.
Thank you so much for that lovely introduction and welcome. May I call you Leana, or should I be more formal and call you Dr. Wen?
Leana is entirely fine. It's just my great honor to join you today, Lisa.
Well, I'm so glad to meet you, even virtually. You know, I love the book. I'm just going to hold it up so everyone can see it. I guess it's coming out backwards, at least on my screen. But what I loved about it is, you know, it's a memoir. It's a doctor's journey in the fight for public health. But what I love so much is that it's such a very, very personal story. And I think all of us can relate to it in different ways. So I'd like to divide our conversation into three parts. First, about your sort of childhood and growing up. Then the experiences you've had in your personal life that have affected or had an influence on your views on public health. And then have a chat about where we are in this country with public health, with some fun stuff thrown in as well, just for fun. So let's start with your background. As you know, I was hugely moved by your immigrant story. Can you talk a little bit about that, being born in Shanghai, living with your grandparents, what happened to your parents and to your family during the Cultural Revolution? I'm throwing a bunch of stuff at you, but what happened during the Cultural Revolution, what Shanghai meant and means to you, and then a little bit about how your mother came to study here in Utah.
Well, Lisa, I so appreciate the way that you introduced the book, in part for a couple of reasons. One is that I actually had not intended to write any of this. As in, when I first started writing Lifelines, my goal was to tell the story of public health in Baltimore. I wrote the book actually, and submitted it to my publisher pre-COVID. That's a whole different story. But as you can imagine, it was heavily rewritten once the pandemic started. But my initial concept was to put the face on public health, because so often people don't understand public health. They only see it when something bad happens, as opposed to all the life-saving work that's done. And so I wanted to write this positive story of public health. But then as I was writing the book, I also recognized that so many parts of my own history, including my immigrant story, is also a story of public health as well. I just had to figure out how to tell it. And so this actually brings me to the second reason I'm so glad you asked the question, with the emphasis on you, and why I'm so honored that you are facilitating this conversation tonight is I have admired your work for so many years, and the way that you, with on Gold Mountain, but so many of your other works, how you delve into stories and
Mhm.
how you find these very deeply personal elements in people's lives as a way to share a broader message. And actually, I was trying to channel you. I mean, you wouldn't have known this before, obviously, but I was trying to channel you when I was writing the first part of this book, thinking, how would I tell the story? In my case, with few people who actually knew the history,
Mhm.
and who often, in this case, when I asked them about my parents, my grandparents, told differing versions. And so I had to figure out how to piece that together. But all this is to say, I was born in Shanghai, in China. You're as a child, you don't think that there's anything particular about your upbringing because that's just
Mhm.
what you know and what you grow up with. Um, I was always curious about my family, but I wasn't allowed to find out very much. And I think that this is true for many people who lived through the Cultural Revolution, people of my grandparents and my parents' age. There was a level of paranoia, such
Right.
that I remember when I would ask certain questions about just about where they went to school or what things were like. I mean, very basic, normal questions. I would be shushed and told that, but we can't talk about that. Someone is listening. And I always thought, but who's listening? But that was the paranoia that was there. So there was a lot that I didn't know that I only found out later. And that includes that my grandparents were my grandfather was an academic who was jailed during the Cultural Revolution. My father was in college at that time and also jailed and subsequently as well. My mother was young at the time. During the Cultural Revolution, she was a student, and she the cultural part of the Cultural Revolution was that they stopped formal schooling, and the last grade of formal school that she went to was the fifth grade, which I reflect on this now because she was able to test into college. I mean,
Mhm.
when colleges and universities were open again, um, she had this one shot to apply to college and to test in. And I think to go from having a fifth grade education and then studying by candlelight to being able to test into college is really remarkable. But in any case, I always knew from an early age that our goal was to leave China at a certain point because of the political issues that my family faced. And I don't think I quite realized, though, how much the burden was on my parents' shoulders. That my mother, for example, studied so hard so that she could come to the US as a graduate student.
Mhm.
My father and I subsequently followed. We initially lived in a little town in Utah, which is another story of
And
how we
just
got to
say for
Utah.
everyone how much money your family had when you all got here.
Yeah, I mean, it was hard, right? We didn't have
$40, right?
$40. We had
Yeah.
$40, and that was all that was left after applying for the visa, getting the plane ticket, and we ended up in this little town in Utah in the middle of December when we came. And I just remember it being really, really cold. I mean, we didn't have winter coats or blankets, and we didn't have enough money to pay for heating. And so I remember going to school with like 5, 6 pairs of pants and many sweaters because that's how we could keep warm.
But it sounds like your neighbors and different people kind of embraced you, brought food, brought clothes. That there really was a lot of kindness from strangers, at least in Utah. Um, this is a tiny question, but it does tell us a lot about the immigrant experience. I don't know if you know this, but my great grandfather was Fong Si. I'm actually a Fong, but my last name is Si. And the story in our family, there are two. One is that when my great grandfather came through, they said, where are you from? He said, from across the sea. The other is that he just said his name in the Chinese way with your family name first, and then he was the fourth brother. So it's number four.
Right.
And that's how we ended up C's. But can you tell everyone about your name and how you ended up Leana?
Yeah, I mean, it's interesting because I like my name. It's my name now. I don't wish that it were something different. Although the way that it's spelled, it's always mispronounced as Leanna. And I always bristle because when I first came to the US, we were living in Utah, and it was my understanding that we all had to have American names. And so my grandfather, who spoke English, and my mother, we had discussed in advance what we wanted my American name to be, and I didn't know English. And so they read me a bunch of names, and I thought the name that was close to my Chinese name, which is Wen Lian, the closest name was Linda. So I thought, great, I want my name to be Linda. And so I said this to the immigration official who wrote my name, Linda, as Leana, which we subsequently pronounced Lena. So here we are.
So you were 10 years old when you came to Los Angeles. It sounds like that was a pretty tough time. The family was really struggling. People were breaking in. I thought one of the pretty horrifying things was one of the burglars left a note, "Go away, chinks." I mean, that's pretty low. You were in and out of shelters, living in motel rooms, and then your sister was born, Angela. And because the family was in such dire circumstances, she was sent back to your grandparents in Shanghai. And you wrote in the book, "It would take me years to understand the difficulty of my parents' choice and the depth of their sacrifice." Can you talk a little bit about that?
I remember, and again, I had, I think, blocked out a lot of my upbringing. It was difficult to go through and difficult to talk about. I mean, I wrote this. I remember writing these early chapters about my story, showing them to my husband, to my sister, who said, "Well, I didn't know about this. I didn't know about that. They never heard me talk about it."
Mm-hmm.
And I mean, the one memory, actually two memories that I have that are so strong of growing up. One of them is how my parents worried every single day about two things. They worried about money and they worried about immigration. We were so close so many times to losing everything. I mean, we
Mm-hmm.
were evicted and were in and out of shelters. We depended on Medicaid. We depended on so many public services just to get by. And my parents were working multiple jobs. My father was delivering newspapers and washing dishes in a restaurant. My mother was studying to be a teacher. She eventually became a second grade teacher in LA Unified. And then she also though was working in a video store and cleaning hotel rooms. I mean, they were doing everything, but we still had trouble making ends meet. And then we also worried about our immigration status all the time. Here, we also came so close. I mean, we were weeks from not having legal documentation in the US. And my parents had all these plans. I mean, there was a plan even for my parents to get divorced, for my father to enter a paper marriage to someone
Mm-hmm.
else, for my mother and I to move to Canada. I mean, we had all these plans, and at the last minute, we were granted political asylum. But it was in that very difficult period when my little sister was born. I was 11 and a half, and I was so happy to have a little sister. I mean, at the time that I was growing up in China, there was the one child policy. So
Right.
I didn't think that I could have a sister. And then I thought, oh my goodness, I mean, there are all these hardships that I went through. I don't want my sister to have to go through these hardships. I want to show her these things that I didn't have. And so I was I thought very selfishly at that time about how I was sorry that my sister had to go to China. And what you're referencing and what I wrote about the depth of my parents' sacrifice, and in particular my mother's sacrifice,
Mm-hmm.
my little sister was sent back to China when she was 3 weeks old. She didn't come back until she was three and a half.
Yeah.
We didn't have FaceTime or Skype, and we would maybe talk to her once a year. And
Mm-hmm.
now that I'm a mother myself, and I have two little kids, I can't imagine what my
Right.
mother must have gone through in partying with my sister, in making that kind of decision that obviously was, they thought it was the right decision for her, for me, for our parents. But I can't imagine what was going through her mind at the time. And I mean, writing this book, I also have so many regrets. I didn't intend to write so much about motherhood. I think part of it was I wrote this book when I was pregnant with my daughter, who is now 16 months old. So I thought about it very consciously. But I also ended up writing so much about my mother, and all these regrets came back. I mean, I said things to her at around that time about how could she possibly let my little sister go back to China. I can, I regret so much saying that now, understanding how it must have made her feel.
We're going to come back to your mom in a bit. Don't worry, I'm not going to just let that go by. I so just I don't want to spend a whole lot of time on this, but why don't you tell everyone how old you were when you started college, and then how old you were when you went to medical school?
I was 13 when I started college at California State in Los Angeles.
Where my mom started, and my dad.
So the many connections that we have, and I see some people in the chat who also have Cal State connections, and so this is the reason why I am so glad to have Romans be where we are having this virtual conversation because of our many LA connections. Yeah, so I was 18 when I graduated from college and when I started medical school.
Amazing. I mean, it's just amazing, and I think you didn't fall too far from the family tree, as from your mother, who was able to do so well with just her 5th grade education to pass her into the college stuff. So, immigrants, as we know, get targeted and blamed for so many things, bringing in disease, bringing in whatever. But to me, you really are like a living example of Lin-Manuel Miranda's, immigrants, they get the job done. What would you say to anyone who's listening or watching with us tonight, who might be an immigrant, who might be a dreamer, who might be the child of immigrants, or even people who are citizens born here who benefit daily from the work of immigrants?
Well, this was also one of the reasons I wanted to tell my story too. There is so much rhetoric about immigrants and how we are taking advantage of the system, right? That somehow these are entitlements that we have access to. And I look at, for our family, that was never our intention. I mean, our intention was not to come to the US and somehow live off the system, right? I mean, that it was our intention was my parents were professionals in China. They wanted to do everything they could to get an education here in the US to make sure that me and my sister, that we have the opportunity to pursue our dreams. And they made so many sacrifices so that we could do this too.
Mm-hmm.
The many things, we were very lucky that we had Medicaid, and therefore my father, when he had a bleeding ulcer, he was able to get medical care. When my mother was pregnant with my sister, we had WIC, the Women, Infants, and Children program, so that she had nutrition and she was able to have a healthy pregnancy. I mean, these are things that aren't entitlements. They were our lifeline. They were what helped us. They were our ultimate safety net. And I've thought a lot about, in the previous administration, for example, with the public charge rule, this idea that if you were to take and benefit from these services, that somehow it might influence your ability to stay in the country later, and the untenable choices that we were giving people. I mean, one of the other things that I talked about in the book was how growing up, I saw so many examples of people who did not have access to healthcare. How there was a boy, even a neighbor of mine, who literally died in front of me.
We're gonna get to that in just one second.
Oh no!
Hang
okay.
on.
Oh no! I'm ruining.
Okay, because you just segued right into part 2. But before we go into that, I just want to remind everyone that there's a little box at the bottom of your screen where you can order the book. So don't forget to do that. You're supporting Lena, but you're also supporting Vroman's, our favorite independent bookstore in here. Well, for me, anywhere, but here in Los Angeles. So as I said at the beginning, I had this sort of in 3 parts, and there are certain personal experiences that you write about that really it seems to me, really turned you into the person that you are today, and into the kind of doctor you are, into this whole field of public health. And I'd like to focus on 4 of them, because each of them are things either we have faced, some of us have faced ourselves, or they might be coming down the pike. So your experience is as one person, but you also happen to be a wife and mother and a daughter. And so I want to just go straight to the story that you were just about to tell.
Sorry
Lifelines
wait.
opens with this very harrowing story of a little neighbor boy who's having an asthma attack. And you were in the 5th grade. We're already living here in Los Angeles. What happened next?
Yeah, I think I gave away the ending of that story, but
No, you just
nevertheless.
started. You had only started. I completely cut you off.
No. Um, yeah, that's something else from my childhood that I do remember very clearly. I mean, there are parts of my childhood that are kind of fuzzy. And you know how you look at photos and you're like, do I really remember this? Or is it that somebody told me the story?
Right.
Well, this is one of those stories that I can see as if it just happened yesterday. Um, I was maybe 10 years old or so at the time. And there was a neighbor boy who was a couple years younger than me. And I often walked with him to our school. I didn't know him well, but we saw each other all the time. He had asthma, and I also had asthma, which is relevant in this case because I knew what it was like to have severe asthma. When I was in China in particular, I was in the hospital almost every month because of asthma attacks. And I knew that feeling, that awful feeling of taking breaths in, but not being able to fully exhale. And
Mm-hmm.
then you're taking another breath and you don't know whether the next one is even going to happen because you just don't, you have that feeling of awful dread that comes over you. So I understood that. And one day I heard his grandmother shouting for help. So I ran, and one of our other neighbors ran as well, and saw this boy was really struggling to breathe. And I saw that his inhaler was empty. I got my inhaler to help him, wasn't working, and I just could tell. I mean, as somebody with asthma, I just knew that something else needed to happen. He needed to get to the hospital. And I was pleading with his grandmother, please let us call 911. But she wouldn't because she was really afraid of what would happen. The family was undocumented and she was afraid
Mm-hmm.
that they would all be deported if the authorities, she didn't know that it was health people and not other authorities, if these authorities would come. And as a result, this boy died in front of us, not because of his grandmother and her
Right.
not being able to call for help, but because we have this system in our country where we clearly do not value people the same way, and where health is not understood as the
Mm-hmm.
fundamental human right that it really needs to be.
Yeah. And would you say that at that point you were already thinking about becoming a doctor, or was that something that just stayed sort of in the back of your mind? And then as things, I mean, I know at that time it wasn't even a possibility that you could really even imagine, but it must have been something that stayed with you and influenced you, and certainly the choices you've made. And in terms of even just of choosing public health.
Oh, very much so. I mean, for example, when I eventually ended up going into medicine, I never wanted to be in a position where I would ever have to turn anyone away
Mhm.
because they didn't have money to pay, because of their health insurance status, because of their immigration status, or anything else. And so for me, that's why going into the ER was the most natural thing to do, because these are the days before the Affordable Care Act. I did
Mhm.
not want to turn away people who were uninsured. But I would say also that, I mean, I think I knew from an early age that I wanted to be a doctor, but to your point, I really had no idea how. And
Mhm.
I see some people in the comments writing that they also went to Cal State LA, and so I think
Right.
they might particularly appreciate this. That I remember when I first entered Cal State LA, I was too afraid to tell people that I wanted to go into medicine
Right.
because I thought people would laugh, frankly. I thought people would say, but who do you think you are to go to medical school?
Mhm.
And I don't know that I would have been able to answer that because I didn't know any doctors. I mean, I had a pediatrician, but my parents, they didn't have friends who were doctors in the US. We didn't know it was not like our neighbors were doctors and I could go to them for
Right.
advice on how to do this. And so I remember actually one of my professors, and I mean maybe one of you in the audience knows some of these individuals too, but Dr. Raymond Garcia, who has since passed away, but was in the biochemistry department at Cal State LA. I was in a program that he ran, and I one day, you know, he kept on asking me, what do I really want to do? I would tell him that I wanted to be a lab tech because I thought it was believable. I mean, my parents had a friend whose daughter was a lab tech. I was working in a lab and studying
Hmm.
biochemistry. I thought, being a lab tech made sense. And one day he said to me, "Is it really what you want to do?" And I told him, "No, I actually really want to be a doctor." And he said, "Great. I will introduce you to my former students who are now in medical school and residency." And that made all the difference because, as I learned, there are so many unwritten rules
Right.
that I just wouldn't have been privy to. I mean, I didn't know that you were supposed to take test prep courses for the MCATs, or that you were supposed to have all these volunteer experiences and work in, and I wouldn't even know where to get these volunteer experiences and shadow people working in the ER or whatever. I wouldn't even have known. And so
Hmm.
I just think now so much about the phrase that talent is universal, but opportunity is not. And in a sense, that is the work that we do in public health too.
Yeah. So I lost my mom 5 years ago, and my grandmother quite a few years before that. And I'm sure there are many people who are watching who have elderly parents or other family members who've faced this kind of moment of tremendous loss. And when your mother had breast cancer, she had a DNR order. And I know you got a lot of pushback from people. Oh, she's so young. Oh, you shouldn't do that. How can you let your mother die? And I think probably many of us watching here tonight have been through that, either the same experience or a similar experience. And how did, what advice would you give to people who are looking at that, or see that on the horizon? And how did that experience change your views on death and dying, and how that's, I guess, for lack of a better word, managed in this country?
Yeah, I mean, I'll tell the story
And of course,
here.
we're living in a time of just tremendous death and dying. So
Right, exactly, and tremendous loss and
yeah.
suffering as well. Um, well, I spent a good portion of the book talking about my mother, so I'm glad that you're bringing this back up. And my mother was in her 40s when she was diagnosed with what turned out to be metastatic breast cancer. She and also she had gone through about a year of misdiagnoses. And I was her caregiver for 8 years while she went
Mhm.
through chemotherapy, radiation, surgery, multiple rounds, and went in remission and then came back. And I mean, it was a very challenging time for a number of reasons, including that we felt like the medical system wasn't always working for us. And by the way, I was going through my medical training at that time. My mother was diagnosed with cancer when I was a second year medical student. She passed away when I was a resident. And so my entire medical training coincided with her illness as well. And so I saw this disconnect firsthand because I saw how hard doctors and nurses were trying. That it's not that it's not the healthcare system is full of bad people who are trying to do something wrong, right? I mean, that's not the case. There are amazing people who want to do the right thing, but there is a disconnect that's happening. So how do you bridge that disconnect? And I ended up doing a lot of work around patient advocacy. But this specific instance that you're mentioning was my mother was someone who knew exactly what she wanted. She was very clear about her intentions. And so clear about her intentions that I think she knew, she must have anticipated the kind of pushback that her family would get, that we would get, that she not only did she enroll herself in hospice care, she also wrote up her will, made many copies of it, wrote an explanation of her will in Chinese and in English so that there would be no question of what she would want, which was what she wanted to die at home in peace. She did not want extraordinary measures to be taken. She did not want intubation, not resuscitation. I mean, she was very clear about what she wanted. And I was away. I was in medical school in St. Louis, and then in residency in Boston. So at that point, I was in Boston. But I was away when one day my mother, she was already in hospice care, really struggled with her breathing. She had pneumonia, and I think at some point she was coughing and turned, a scary color. And my father panicked, as I think many relatives do
Mhm.
in this situation, and called 911. And so the ambulance came and took her to the hospital, at which case her hospice order was no longer valid. And her DNR, do not resuscitate, do not intubate, etc., order was still there. But my father called me. I rushed to LA, and at the point that I arrived, they were about to intubate my mother. My sister was 16 years old at the time. My sister understood exactly what our mother wanted and kept on telling them, please don't do this. This is not what she wants. She's 16 years old. She's holding up this piece of paper that my mother wrote and made sure we all had copies of it. And the doctors, again, it's not that they were poorly intentioned, but they said things like, but your mother is so young.
Right.
How could you face yourself if you really don't do everything to keep her alive? I mean, I think about these words now. It made it sound like we were being somehow uncaring, when actually the most caring thing that we could do was to carry out the orders that she so very clearly stated. And I think, to your question, Lisa, I think that it's really hard. I think that what my mother did was the right thing. She made sure that we all knew individually what she wanted. She had it legally documented. She had so many copies of her intention and explanation. I would encourage families to have these types of conversations, and also to know that the medical system that we're in is imperfect, that it's got many flaws. And yes, we should be changing the system and working on many problems in our system, including systemic racism, including doctors not having enough time to talk to our patients. I mean, many issues. But while we are working on these issues, people are facing life and death decisions right now. And we really need to advocate for ourselves as we're working towards longer term change too.
So, and this is the last of the personal ones. I'm starting to fall behind a little bit. So but I really want to ask this and just talk about it for a minute. So, I remembered earlier in the pandemic when you were pregnant, and I was so worried for you. I don't know you, but I was always so worried for you. And I should just say that throughout this whole 18 months, you have been the voice of calm for me. When everything started to get really dark, and I would just listen to you on CNN and I could kind of calm down. But then, and you were in the medical trial for the vaccine, but you didn't know whether you'd gotten the actual vaccine or a placebo. And then your husband and both of your children babies got sick, right, with COVID. And the thing I thought about a lot is, mothers don't stop just because everybody's sick and you shouldn't be around and you should be in your mask and you should isolate. I mean, you can't isolate a baby and your toddler and your husband. And so, I think that your experience, especially now that cases are rising with children, I think could really be very helpful to people out there who are afraid that this could happen or maybe are experiencing it already. And so I guess my question, is, what from your own experience, and of course you do write about it in Lifelines, you can order it right here. But what from your own experience would you tell people to maybe think ahead if that happens?
Well, what happened with my family was pre-vaccine.
Mhm.
And I say this with no judgment, I mean, with full compassion, regardless of whether, I mean, we need to treat people with compassion who are ill, regardless of are they vaccinated or not. I say this, though, because at that time, we didn't have the opportunity to be vaccinated, which changes the equation a lot now. So what happened was I was in a vaccine clinical trial. I didn't know whether I'd gotten the placebo or the vaccine. I had a 50-50 chance. My husband
And you
came
hadn't, by
down.
the way,
I'm sorry?
right? You didn't get it, right?
That's right. I ended
So
up
you
getting
got
the
the
placebo. And then
I kept
eventually, of
thinking when
course,
I
I
would
got the
hear you
vaccine.
say that on CNN, I thought, oh, she got the real thing. Make sure she got the real thing, but no.
Well, I was convinced that I got the vaccine because I didn't get COVID. I mean, I was, when everybody around you, who you have very close contact with, gets COVID, you think, oh, well, in that case, I must have gotten the vaccine. But anyway, it's a separate issue. In this case, my husband, who had founded a startup and was working really long hours, he started feeling really tired, but he wasn't getting much sleep, and so he had a headache and was feeling run down. And we just thought, oh, it's because he hasn't gotten sleep. He's working really hard. And then one day he suddenly lost his sense of taste and smell. That same day he spiked a high fever. And we knew that it must be COVID. He got tested, and of course, it was COVID. And at that same time, both of our kids started developing symptoms as well. And again, the days pre-vaccine, and it just was a really frightening time. I decided, I think, as many parents, moms, caregivers would in the same circumstance, I thought I have a 50-50 chance of being protected. And I'm going to take this chance because it's my entire family. You know, you have to be a caregiver and care for your family as well. And so I decided to not isolate and to care for everybody else as well. And so,
But let
I
me
mean, I think that,
but I do want to ask you something very specific because I think this could be helpful to people. So let's say you're a family, everybody's vaccinated, but not the kids under 12. So, what happens when those kids, I mean, and I just even this evening, you were on CNN talking about this,
mhm.
but what happens, how should a family react? How should they act actually if one of the children gets sick in the household?
Yeah, so there is the what you should do, and then practically what ends up happening. So
Right.
let's say that there are two young kids, right? So two very, I mean, my kids are 1 and almost 4. So let's say that they're kids of that kind of age. They
Hmm.
can't care for themselves, right? I mean,
Hmm.
that's very different. I think if you
Right.
have an 11-year-old, 11-year-old can probably do a lot by themselves, but a 4-year-old or a 1-year-old really needs
Right.
full-time care anyway, regardless of whether they're ill or not. Um, I made the point of a vaccination because things change a lot now that parents are vaccinated. Or at
Right.
least, I mean, in this case, let's assume that the parents are vaccinated, but the children are not.
Right.
If there
Hmm.
is one child who is ill, I think it would be reasonable to say, well, first of all, let's test everyone, but let's also specifically test the other child and ideally separate those kids because you don't want the one child who is infected to infect the other unvaccinated kid. If there are two parents, there is an easier way of doing this. One parent can stay with one child and the other parent with the other child. It becomes a lot more challenging if it's a single parent caring for both children.
Hmm.
But in that case, I would recommend that the parent, so if it's two parents caring for one child who's ill and one child who's not, both of whom are unvaccinated, ideally you can separate them in the house. And the parents can also separate from one another. So one person is assumed to be exposed and the other person is not. If it's a
Hmm.
single parent caring for both children and one is and again the same issue, I think it would be reasonable to put the kids in different places. Definitely isolate the child who is ill, and the parent, when around that child, should be masking and taking all the precautions so as to not get infected and then bring it to the other child. That's kind of the idea, the
Right. Idea.
circumstance, assuming that you have space in your house, you have the ability to not go to work and care for the kids, which is not things that a lot of parents might have either.
Mhm. So now I want to shift really to just public health in general. I know we've been touching on it all along, but as health commissioner of Baltimore, you tackled so many social and health issues, the same kinds of things we have here in Los Angeles and in every city and town around the country. Gun violence, opioid crisis, addiction, mental health issues that arise out of poverty, race, gender, all kinds of things. And in Lifelines, you've outlined several of your own successful programs that you implemented in Baltimore. I could go through a lot of them, but program for healthy babies, eyeglasses for kids in Baltimore, just all kinds of things that you outlined. But I really do see Lifelines as really a call to action for our cities and for our communities. So, what are the things you think we could be doing now? And in an ideal world, what would public health look like in 5, 10, 15 years from now?
Hmm. Well, I love that question. Thank you for asking it. I would say so. There are things that we can do now, and I'm going to give 3 examples of programs from Baltimore to demonstrate that the kinds of things that I think every city, every locale can be doing. Um, One of the mayors that I worked for, the mayor that appointed me in Baltimore, Mayor Rawlings Blake, used to say, "If everything is a priority, nothing is a priority."
Mhm.
Meaning that you have to start with something. And for us in Baltimore, for example, key one of the key issues facing our city was addiction. And I knew that there was something that we could do about it right then and there, because we have an antidote to opioid overdose, naloxone or Narcan. And so I was able to work with our state legislature so that I became the single prescriber for naloxone for every resident in our city. So I issued a blanket prescription to 620,000 people. And as a result of that, as well as doing trainings, everyday residents were able to save the lives of more than 3,000 people in Baltimore over a 3-year period. And I give this example because there will be something that people can do in their locales as well, related to COVID or something else altogether. And at the same time, you've got to focus on something and don't do everything at once. The second lesson is that you can't do, this is along the same lines, but I think sometimes because public health ties to everything, sometimes there is this almost this decision paralysis of, well, if health is influenced by housing and food and the air that we breathe and the water that we drink, where do we even begin? But sometimes it's important to pick something really tangible. And that's the example of glasses that I gave in the book as well. We had a program to get free glasses for every child in Baltimore who needs them. A pretty simple intervention, but I don't think I need another study to say that if our kids can't see, they can't read and they can't learn. And so that's something that you can do right now and not let perfect be the enemy of the good. And the third lesson is about equity, that we need to stop seeing disparities as somehow a zero-sum game. You don't add years of life from one group of people and give it to another. This is really all boats rise. If you focus on the most vulnerable and focus on reducing disparities, you're also improving care for everyone. So our Healthy Babies program, as an example, we were able to reduce infant mortality in our city by 38% in a 7-year period. And we also critically were able to close the disparity between Black and white infant mortality by over 50% in that same time period. And so you can be intentional about equity and improve care for everyone. So as to where I hope that things will go in the next 10 to 15 years, I hope that people finally understand the role of public health, that we all play a role in this. I think we're seeing this firsthand in COVID, that all of us are actually on the front lines of public health. But I hope we put the face on public health and stop reducing funding for this really critical field, because ultimately it's so important for not only health and well-being, but also for social justice, for equity, for leveling the playing field of inequality as well.
So I'm just going to do a couple fun little questions and then one last question. So I just want to tell everyone in the audience that we're going to be opening this up to your questions in a couple of minutes. So please just type in your questions and so that we're ready to go. Okay, so to me, the obvious question, how'd you get started with CNN? Did Anderson Cooper just call you up one day and say, hey, come on down?
Actually, I had previously worked with Sanjay Gupta. And so during COVID, I was early on involved in the coronavirus town halls that Anderson and Sanjay were doing. And so I'm very glad to be continuing on with CNN as a medical analyst there.
And as you know, I follow you on Twitter, and I was so excited when you got the room raider thing. Yeah.
With this room, in fact.
With that room? But is that kind of thing fun for you, or what do you think? Or it's just silly, or what?
Oh, I mean, I think we've all kind of coped during the pandemic in terms of settings. I would say that in general, being on webinars and Zoom and everything is stressful because of my kids. And we live in a small house. I mean, we're very fortunate to live in this house, but we live in an old house where sound travels very easily. And so at all times, I'm worried about, oh my goodness, is the baby going to cry? Is the toddler going to throw a tantrum right on air in front of
but that's very funny because question 15 was, where do you hide your kids?
I have a
because
wonderful
I think
husband.
We've all seen, people on television, they're doing their serious report and then some little kid runs through it, so you've done a remarkable job with that, I must say. But there are times I wonder, where is she hiding them? Okay, so just one last question. I have several more here, but the one I wanted to end with is you've had a pretty interesting relationship with Congressman Elijah Cummings. And one of the things he wrote or said was, the cost of doing nothing isn't nothing. So what did he mean to you, and what does that quote mean to you?
Well, Congressman Elijah Cummings, the late Congressman Elijah Cummings, was my mentor, and someone who I think about every day. I think about him every time I look at my son, because I named my son Eli after Congressman
Oh,
Cummings. And one of the things among many that Congressman Cummings talked about is this idea that I also think about every day, which is of pain, passion, and purpose. That you channel your pain into your passion that is your purpose, which is how I live my life, as in all these things that I feel so passionately about also came out of deep points of pain at some point as well. And Congressman Cummings, just to share one thing about him, um, whenever he went to events, and I had, a lot of members of staff and colleagues and friends who met him and told me about this very specific experience with him. That no matter how many people were around, when he started talking to someone, he made them feel as if they were the only person in that room. And I met so many people who, after their conversation with Congressman Cummings, were in tears because they
oh,
said for the first time someone really saw them and someone
mm-hmm,
heard them. And I think about that all the time, about having that level of compassion and empathy and caring for a person that you just met, that you make them feel like they are truly worthy. I mean, that's one of the many reasons why I named my son after Congressman
oh,
Cummings. But the specific quote that you're referencing about the cost of doing nothing isn't nothing. So much of public health is about prevention. And our programs end up getting cut year after year because people don't understand that we are successful when we have prevented something from happening. I mean,
mm-hmm,
there isn't the face of prevention by definition, right? There isn't the face of someone who got COVID, but who could have gotten COVID if not for the fact that they got the vaccine. Or
mm-hmm.
there isn't the face of someone who could have gotten lead poisoning if not for the home remediation that was done. And so that I think was Congressman Cummings' point, that you can't just talk about if you cut a program, there is a cost to that. If you're not doing prevention anymore, there is a cost to that. And actually, I really worry right now, in the time of COVID, when so much has become so politicized that really shouldn't be. I mean, masks. How has that become a symbol of freedom, or whatever people want to call it, rather than really a piece of cloth that is a life-saving measure, right? I mean, so
Mm-hmm.
I really worry about what the future of public health might mean, when we don't understand that cutting out something actually has a profound consequence.
Okay, thank you. So I just think this has been such a great conversation. I really hope everyone buys the book. And let's bring in the people from Vroman's to tell us the questions.
Hi. Okay. So I just turned my mic back on. So let me go through the questions here. We have quite a few. This question is from Peggy. Do you have any thoughts as to how to educate the American public on the importance of community health and our health choices and how it affects others?
It's a great question, and I think about that a lot. I think two things here. I think each of us has a role to play here, even when it comes to something like the importance of vaccination. In public health, there is a phrase, that the messenger matters as much as the message. There is someone in your life for whom you are the most trusted messenger. And I truly believe that change begins at home. Change begins with the people who are within our sphere of influence. And so when it comes to educating people, whether it's about the importance of vaccination or the importance of public health writ large, start with people close to you to let them know about the importance. And then the second thing too is I would make it really tangible. I mean, this is the reason why I wrote Lifelines, to illustrate all these real concrete examples of how public health makes a difference in people's lives, whether it's helping our corner stores become healthier by giving them, or by allowing them to have partnerships and facilitating partnerships with farmers markets. I mean, that's a very tangible example that people can understand that matters in their lives. And I think we need to really illustrate the importance of public health and community health with these very tangible, specific examples that are relevant to people's lives.
Wonderful. Okay, so our next question is from Pam. Dr. Wen, I am one of the people who got a breakthrough infection and had a mild case of COVID in July, being fully vaccinated since March. Does this necessarily mean I should get a booster when they become available? Thanks.
It's a really good question, Pam, and I would say that at this point, we don't know the answer to this. We are due any moment now to have the guidance of our federal health officials, of the FDA and CDC, about boosters for people with immunocompromise. We do not yet know about the guidance for boosters for everybody else. Israel, Germany, the UK, they are now saying that older individuals may need booster shots. I think it's very likely in the US that people are going to need boosters. Now, yours is a specific circumstance, which is, I think you're asking, you got a breakthrough infection after getting vaccinated. Do you still need a booster? I don't think we know the answer to this. I would surmise yes. And the reason is we know that natural infection does give you some level of immunity, but we don't know how durable that immunity is and how consistent it is. We know that if somebody initially has been infected with COVID, they should be getting vaccinated after that. And so based on that, I would surmise that even if you got a breakthrough infection, when boosters for your age group and other risk factors is recommended, I would guess that you would also want to be vaccinated, although I will want to wait for the official advice from our FDA and CDC, but that's my best guess at this point.
Okay, there were a couple of people who had questions about the Biden administration and how they're handling the pandemic. So, just to combine all of these questions together, what are your thoughts on how the Biden administration is handling the pandemic, and what more can they do as of this moment?
I think the Biden administration has done an incredible job considering what they inherited. I mean, we had a situation back in December where the rate of vaccine rollout was really slow. We didn't know how much supply was going to be there. Our federal health agencies were in disarray. And our top scientists were muzzled and not allowed to speak to the American people. I mean, there were serious issues that the Biden administration came in and tried to fix. They did so much. I mean, the fact that we, starting in May, were sitting on surpluses of the vaccine, they fixed the supply issue, worked to get distribution. They really focused on health equity, which I really also very much appreciate. I think they did a lot that was right. I think there are things that could be improved upon. I do think that their messaging at times has been confusing. I was very critical back in May when the CDC came out with their guidance saying that vaccinated people do not need to wear masks. That was correct scientifically, but you can't just get the science right. You also have to get the policy and communication right for effective public health. And what ended up happening, as you all know, is right after the CDC came out with that guidance, it was understood as mask mandates have to go. And as a result, the mask mandates went, and then unvaccinated people started behaving as if they were vaccinated, as in we could not have trusted this honor system. I think that was a major mistake. I also think that the Biden administration really needs to get behind proof of vaccination because, again, I don't think that we trust the honor system. I mean, when you go to the airport and go to a TSA checkpoint, they don't just say, you are who you say you are? Great. You say that you don't have anything dangerous in your suitcase? Great. I mean, they check your ID. You put your bags through that X-ray, whatever detector for a reason. And I think we really need to see, we can't just trust a piece of paper that could be counterfeited. I mean, I think at some point we really need to have some secure method of proof of vaccination.
All right, I think we have time for 2 more questions. This question is from Robin. Um, for Dr. Wen, how frustrating is it for you that despite all your efforts, many people don't trust science and refuse to get vaccinated or wear masks? Do you see this pandemic lasting for years because of this? And this is kind of related to your answer earlier.
Yeah, I mean, I don't know where this pandemic is going to go. I do know that we as a society have really failed. And specifically, we have failed in a primary obligation, which is the obligation to protect our children. We as adults fail to get vaccinated in large enough numbers to contain the surge. And as a result, our children are now paying the price. I am very frustrated by this as the mother of 2 young kids, but also just in general, I'm worried about this. I mean, back to what Congressman Elijah Cummings said, another phrase that I cited in the book is he often talked about how our children are messengers to a future that we will never see. And that the work that we do is for our children. Well, what kind of message have we left to them at this point? So I am frustrated, but at the same time, we can't be frustrated, as in we need to channel that frustration, if you will, the pain into our passion and purpose and do everything we can to counter that pandemic of disinformation too.
Okay, so this is the final question for tonight, and it's from Miriam. How do you balance work and parenting and writing and self-care?
Yeah, I think another question is, do you sleep?
Well, yes, to the sleeping question, although I would love to be able to sleep more, as I'm sure many people can relate to that. I wrote a lot actually in Lifelines too about this concept of work-life balance and how I don't know. I thought before I had kids that somehow work-life balance was like a one-time decision. You make a decision about a job and that's your work-life balance, as opposed to it's actually every single day. There are many decisions about work-life balance, right? I mean, there are decisions about, am I going to be here for dinner? Am I going to take that meeting that's at the same time? Or, there are all these imperfect decisions that I think as working parents or as parents or caregivers, we always feel like we're doing something not well enough. And I think I have come to terms with that and need to keep on reminding myself to give myself and all of us a bit of grace as we're going through this challenging period. I'll end with this. I mean, in terms of self-care, one thing that I've started doing in the last several months, because why not during a pandemic? One of the things that I was always terrified of as a child was swimming. And I think part of it was having asthma. I just always pictured this, being in the water, not being able to breathe. Somehow that really terrified me. And I also grew up in areas where I didn't really have access to a swimming pool. So I never swam. Up until about 3 months ago, I had never put my head underwater. And I made a resolution that I was going to learn how to swim. And so I've started taking lessons with like little 6-year-olds next to me. But nevertheless, I started taking lessons. I am starting to swim. It is a good exercise for me, but also I think it's a deliberate, intentional step towards self-care and to learning something new that I have really enjoyed. And so I would certainly encourage others to also tackle something that is difficult and challenging for them, but that may end up being a form of self-care and learning as well.
All right, so we are out of time. Thank you so much, Leana, for your words of wisdom. Thank you, Lisa, for facilitating such a wonderful conversation. And thank you to all of you who tuned in tonight and were commenting and sending in such thoughtful questions. Again, we do have signed book plates available for those who purchase a copy of Lifelines tonight. Just click on the green button directly below the viewer's screen. It'll take you to our website. Just make sure to write signed book plate in the order comments when you're checking out your cart so we know to reserve a book plate for you. And for those of you who tuned in late, don't worry, a replay of this talk will be available after the broadcast ends. All right, well, that about does it. Stay safe, everyone. Keep your masks on and have a good night. All right, bye.
Bye-bye. Thank you all. Thank you, Leana.
Thank you. Thank you, Lisa.